Do you have a primary care doctor? How patients are seeing their doctor is changing, and that could shape patients' access and quality of care for decades to come. Let's look at primary care in the U.S. More than 100 million Americans don't have regular access to primary care, a number that has nearly doubled since 2014. Yet demand for primary care is up, spurred partly by record enrollment in Affordable Care Act plans. A solid relationship with a doctor who knows your history and can monitor new problems has long been regarded as the foundation of a quality healthcare system. Still, some younger people are ditching traditional primary care, opting instead for minute clinics or other quick and more convenient options like telemedicine. But if patients aren't seeing the same doctor on a regular basis, there's a risk that physicians may not be able to spot concerning health patterns. At the same time, the U.S. is investing in primary care far less than other high-income countries. The nation has a smaller share of primary care physicians than most of its European counterparts. Only about a third of physicians in the U.S. are primary care doctors. That means it's often hard to find a doctor and make an appointment that's not weeks or even months away. Another telling statistic. In 1980, 62% of doctors' visits for adults 65 and older were for primary care, and 38% were for specialists. By 2013, that ratio had exactly flipped. Why is this happening? For one thing, not enough medical students are opting for primary care. That's partly because general practitioners are paid less. Just look at these salaries laid out by the U.S. Bureau of Labor Statistics. Some doctors now in practice also say they're burned out. Others are retiring or selling their practices. Indeed, hospitals, insurers, corporate giants like Amazon, and private equity firms are on a buying spree, snapping up primary care practices. About 48% of primary care physicians currently work in practices they do not own. Experts told me that failing to address this primary care shortage could have long-term implications. As a result, Americans could see worsening health outcomes.